Hi, this is Kathy. She came to us in December after having a lot of pain in her back and leg.
I woke up one morning in November and I had just kind of a backache, and I went to work on that Monday and I had a chiropractic treatment, and by the next morning on Tuesday, November 7th, I could hardly walk. I couldn't hardly sit, I couldn't hardly stand. I was basically just ridden with pain and virtually incapacitated. And it was like a lightning bolt that would do like that every time I moved. I couldn't sit, I couldn't lie, I couldn't stand.
And you're active. You told us what you do for work.
Yes, I'm a nurse actually, and I have the most wonderful job. I do home care where I go into people's homes and take care of patients after they've had surgery, or if they're requiring dressing change, or after their medical procedure and their doctor has ordered them home care. So yes, I've been very active, and I could hardly get in and out of the car.
So you couldn't work at that time? Yeah.
No.
She ended up having a large, I don't know if we can see this, disc herniation in her lumbar spine in L4-5.
The doctors who looked at it said it's a massive herniated disc. I had a steroid treatment and it gave me about 5 days with very minimal relief from the pain. The pain was unlike anything I have ever experienced. It was excruciating. With the pain, it being nothing like I've ever experienced, I would only sleep about an hour and a half or 2 hours a night, and I just said, Lord, there's got to be something. I started to look on the internet and I came across Prolozone therapy, and I'm like, what is Prolozone therapy? I'm a nurse, I've never heard of this. And as I was looking, there was one doctor. I said, is there anybody in my area? There was one doctor in the whole state of Minnesota, and it's Dr. Kramer. I came in, I met Dr. Kramer for the first time, and he said, yeah, that's a massive herniated disc.
It's big.
And he went ahead and did the injection at that time. That was my first injection. So when I would lay down on the sofa, my back would periodically like give this big pop or crack. And each time that happened, I thought, this is probably not going to be good. And when I would get up the next day, each time that had happened, the pain would diminish, the numbness and tingling. I had numbness and tingling all the way down my leg. It would come across the top of my foot and up my calf. And each time that this big pop would happen, after I would have the Prolozone treatment, about 2 or 3 weeks later, I noticed that the pain and the numbness and tingling started to go away. And to this day, after 4 treatments, I feel like a new woman.
Yeah. Last time she said she felt like Wonder Woman.
Yeah, Wonder Woman, yes. And it was funny because I saw my niece at Christmas time after just having my first injection. And then I visited about a month later and she was like, oh my gosh, because I was feeling so much better. She said, it's like you made a huge improvement. Because at Christmas I could hardly walk. I could hardly sit.
And now well, what do you feel?
Now I'm animated. I feel like I'm back to my old self. I'm animated and I'm back to my old self, really.
Welcome back.
I feel good. Thank you. I know beyond a shadow of a doubt that it is the Prolozone therapy that has brought me to this point of healing, along with good prayer. That has brought me to the point of healing. I truly do believe that. I'm forever grateful. Thank you.